Hi, my name is Fatemi. I'm the Global Medical Director of ART Fertility Clinics based in Abu Dhabi. Today we're going to talk about individualization and the treatment of patients according to one's requirement. You see, today we have reached the era of individualized medicine. It's not one size fits all. Giving you a very simple example. You see, sometimes women have a good number of eggs, but at the end, when you retrieve them, when you take them out, they're not mature. Or you cannot fertilize them, or once you fertilize them, they don't develop because they are not completely mature the way they should be. Now, there are techniques which are used, for example, called IVM, in vitro maturation, but usually these techniques are used for women who have polycystic ovaries, who have a lot of eggs, and so on. Obviously, we have used that also for those kind of patients, but now we developed it further because we are using it for women who have problems with the maturity of the eggs. So recently we had a case, I think that lady had 4 or 5 failed cycles in different clinics, and there was no maturation of the eggs. And I think once they managed to have maybe 1 mature egg, but this egg was only partially mature. It means we call it nuclear mature. It was not cytoplasmic mature, and there was an arrest. And we did IVM with that patient. Normally, there is no indication to do IVM with that patient. And happily, we had a top quality, genetically healthy embryo, and she's going to have an embryo transfer this month. And hopefully, she's going to get pregnant. Of course, she's happy. We are happy because we ended up with a top quality embryo. So sometimes you have to use the tools you have, and you have to think out of the box in order to implement them in different areas in order to be successful.
So this is a perfect example how collaborative efforts between the physicians and the IVF lab are required for successful outcomes. In this particular case, once the doctors identified what is the best treatment plan for this patient, then it's our responsibility to ensure that we adopt the new technologies, the new protocols in order to optimize the outcome. And hopefully, as Professor Fatemi said, that since we have good lab, we managed to get this good quality embryo, and hopefully this patient gets pregnant.
And maybe something to add, which is important. One of the key areas of success for us is the communication between the laboratory, between the clinicians, and the genetic lab. And I think this holistic approach needs to be highlighted, and it needs to be implemented in all IVF clinics. You see, when I used to work in Europe, in the University of Brussels, we had an entity which was the IVF. You have a laboratory and you have a genetic lab, and each one of them are separate entities. But at the end, you cannot have separate entities. They have to combine, they have to be synchronized. And I think one of the things that we do here, I think you as embryologists, you could do as good as a stimulation as I would do because you have the endocrinological knowledge. We learn from you guys in the lab how we have to improve the egg and embryo quality and what we can do in order to modify. So I think also this communication between the laboratory, genetics, and clinicians, this is also extremely important to be highlighted. The field of human reproduction is evolving very fast, and today it's not one size fits all. You see, we are specializing ourselves in the most challenging cases. It makes life difficult for us because most of the cases we see are cases with multiple failures. But this is also the challenge, easy cases get pregnant. The challenge is to understand the cause of infertility with the couple that we see. And it was always said, 15, 20, 25% of the cases are idiopathic infertility. It means we don't know what's the problem. I can tell you today, idiopathic infertility does not exist anymore. I would say 99.9% of the cases, we find the reason. And once you find the reason, you can try to address it and fix it accordingly.